Hi there, my name is Todd Hurst. I am a cardiologist who specializes in the prevention of heart disease. Welcome to Your Health Questions Answered. One of the most common questions I get, particularly from patients who have recently been diagnosed as having high blood pressure, is, why do I have it? And this is a great question because, as we will talk about later in this video, knowing why you have high blood pressure can help you and your doctor determine the best treatment to lower your blood pressure. And as you will see, you have a lot more control over your blood pressure than you may realize. Before we get started, I will emphasize that this information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. If you have high blood pressure or have been told you are at risk of having high blood pressure, you are not alone. About 1 in 3 adults in the United States have high blood pressure, which is also called hypertension. A blood pressure that is consistently greater than 140 over 90 millimeters of mercury meets the criteria for the diagnosis of hypertension. An additional 1 in 3 adults have elevated blood pressure, sometimes called pre-hypertension. Pre-hypertension is blood pressure that is higher than normal but does not reach the threshold for high blood pressure, which is between 120 to 139 for the systolic or top number, and between 80 and 89 millimeters of mercury for the diastolic or bottom number. As you can probably guess, those with pre-hypertension are at high risk of developing hypertension in the future. So only about 1/3 of adults have normal blood pressure, which is less than 120 over 80 millimeters of mercury. So clearly high blood pressure is really common, but what is causing all of that high blood pressure? When I explain the causes of high blood pressure to my patients, I'd like to separate the causes into ones you can't control and ones you can. The fixed causes of high blood pressure are the ones we don't have control over, and that includes genetic reasons, often indicated by a family history of high blood pressure, as well as simply a consequence of getting older. And getting older has a strong influence on blood pressure. As you can see from this graph, high blood pressure starts to rise in our 20s, and almost 80% of people over 74 years of age have high blood pressure. But even if you have a family tendency or genetic reason to have high blood pressure, or you are not as young as you once were, there are still things you can do to improve your blood pressure and maybe even minimize or eliminate blood pressure medications. And that's why the more important causes of high blood pressure are the ones we do have control over. These modifiable causes of high blood pressure include what you eat or drink. For example, a diet high in processed foods will raise blood pressure, whereas eating a lot of fruits, vegetables, nuts, and whole grains has been shown to lower blood pressure. Drinking more than 2 alcoholic drinks per day can also raise blood pressure. How physically active you are is an important factor in blood pressure. Those who sit a lot or otherwise have sedentary lifestyle have higher blood pressures. Being overweight increases the likelihood of high blood pressure, as does untreated sleep apnea. But the most important thing to know about these modifiable causes of high blood pressure is that they also represent incredibly effective ways to lower your blood pressure. In fact, more than half of all blood pressure is caused by these modifiable factors, and there's a lot of research that has shown that relatively modest changes in lifestyle, like eating better quality food, being more physically active, and losing weight, are as effective in lowering blood pressure as any blood pressure medication. If you're interested in improving your blood pressure and improving your health, you should download my completely free Quick Start Guide to Lower Blood Pressure. There's a link below this video. So now you know that the question, why do I have high blood pressure, is an important one because the answer can help decide the best treatment for your blood pressure. For example, if the reason your blood pressure is high is because you have untreated sleep apnea or because you haven't been as active as you used to be, it may make more sense to treat the underlying cause rather than to add more medication. And as always, I recommend that you talk to your doctor to determine the best treatment for your high blood pressure. Thanks for watching. If you like this video, hit the like button below, share it with your friends and family, and be sure to subscribe. I would love to connect with you on Facebook, Twitter, Pinterest, or Instagram, and you can join my Better Health community at HealthspanMD.com, where we talk about your better health, better life, and better weight loss.